If you just want to keep it simple and you've met an expert and you know that they know what your skin type is, you don't really need to. It's going to be it's not going to be in your budget, but you are going to be spending. But I tell all of my patients, when you're investing in your skin, it's really going to give it to you.
Okay.
Sooner or later, it's going to start showing.
Okay. There is that return on investment.
It definitely is.
Okay, perfect.
Toes and potential.
So we try to kind of
All these tests.
I retired and that's but thankfully.
We are back. Another episode of Tell Me Why, your weekly podcast from Gulf News. I'm Maria Botros, and in the studio with me is Dr. Asima, who is a skincare specialist, guru. I mean, she's going to introduce herself right now, so we're going to leave it up to her to tell us about herself and to tell us about her experience. But the reason why we have Dr. Asima in the studio is because the summer season is upon us, and the heat is real, and skincare and skin protection is crucial and often neglected by people. So, Dr. Asima, how are you?
I'm good. So my name is Dr. Asima Nasir. So I'm from Kashmir, India. A lot of people don't know that, and majority of them get shocked.
I didn't know that.
Yeah, so I've been in UAE since 1997.
Okay.
So pretty long time. So I've actually seen how the world of skincare has evolved in UAE. And I've seen great changes, and talking about currently, I see the improvement immensely, but still there are a bit of flaws which needs to be corrected and obviously been told. Hopefully we can get that sorted soon or later, but yeah. So I've done my schooling in UAE. I have done my university in UAE, everything in UAE.
Amazing.
I have done my internship also in UAE. I worked in UAE, so basically everything in UAE.
You're a homegrown doctor.
Yes.
We love it. All right. So tell us about your experience. Like, how did you get into the field? Why skincare?
Why skincare? It's a very personal story. So I was really small and obviously not a med school or med student. So my mom had this pigmentation. So she was really worried about her pigmentation. She was like, I'm trying so hard, but the pigmentation is not going. And obviously she had other symptoms also, but the pigmentation was the most she's worried about. As usual, she's a lady. She wants her skin to be flawless. So she went to a dermatologist, and the dermatologist was like, everything seems to be fine, but do you mind doing a urine test? And she was like, why? She's like, I just want to know. So my mom was like, all right, I'm going to do a urine test. And turned out to be that she had later diagnosed as chronic renal failure.
Oh, wow.
So other two doctors which she previously visited, and they were like, she's completely fine, and she wasn't. So this dermatologist actually saved up my mom's life in the near future. So it became a bit personal, and not only that, it was my dad's dream. So my dad and my mom, they've never been to school. Like, my dad's been till grade 7, but my mom has never seen school. So my dad goes like, I'm going to have a lot of kids, and all of my kids, if they're girls, are going to become doctors. So we are 3 doctors in the family.
Amazing.
And one of them, the 4th one, she was like, you know what, I can't do it. Like, the 3 of them already. If something goes wrong, I have to handle it. So she became a lawyer. So my brother, so he was like, listen, Dad, if they're doctors, there's a lawyer, somebody needs to understand money because doctors don't understand finance. So he took care of that.
Nice. Oh, that's amazing. You made him proud. I love that.
Yes.
Going back to your mom's story, isn't that fascinating that skin can be an indicator for so many other diseases in your body?
It definitely is a huge indication. So you have to make sure that you need to take care of it because it's the largest organ in the body.
Right.
And it does reflect whatever happening inside, internally. So it's a huge, it's really big. Like, you need to understand, like such small thing like pigmentation. She had a swelling of these eyes, like a little bit of edema around her eyes. So he was like doing the math, and he understood, and then he was like, let's do it. Like, if my mom did not meet him, like, it's a silent killer. Like, how would she know?
Wow.
She wouldn't.
Wow.
And it could have led to a lot of, unfortunately, but thank God for whatever happened.
And it made you who you are today.
It
I
did.
mean, it got you to where you are
But my
today.
mom still does not believe me. She's like, nuh-uh.
She doesn't believe you.
No, she doesn't.
Well, I hope she's listening to this and now she can
Yes.
actually believe you.
Hopefully.
So we often neglect our skin health and like
Yes.
we often don't prioritize skin protection. I mean, I'm guilty of that too. And by the way, my mom worked as a clinical pharmacist in a dermatology clinic for 15 years. And the amount of times that she has nagged me about putting on sunscreen, making sure I don't walk outside, you know, in the peak hours, at least avoid those peak hours, not sitting on the beach for hours and hours, you know, in the peak of the heat and the peak of the summer. And, you know, it's just something that we tend to neglect. Can you tell me some of the biggest mistakes people do when it comes to skincare or skin protection?
I mean, the most major sin in aesthetics or dermatology is not wearing the sunscreen at all. The second is not reapplying at all, or the amount, because the amount is a huge indication in reapplying the sunblock. I have patients which come to me, they're like, listen, I need to get, you know, my skin looking good. I want to look young. I have pigmentations. I have freckles. I look, you know, a certain way. Like, what can I do? So when I start taking the history, I'm like, do you wear sunblock? They're like, sunblock? No, not really. Like sometimes. I'm like, okay. There's some patients, they're like, we do apply and then we go to the beach. I'm like, then do you reapply? They're like, we're supposed to reapply? I'm like, yes, you need to reapply it again. And there are some patients, when it comes to sunblock, the amount. You need to understand when it's sunblock, you have to be really generous. So the more you apply it, I mean, you don't want to look white, but I mean, I would recommend 3 fingers or 2, you understand? 3 with the neck, 2 just the face, but obviously neck is really crucial also.
Yeah.
These are the simple basic steps which they miss out, and it has a huge impact. So, I mean, there are a couple of studies which have shown, I'm sure they're on TikToks, on Instagram, there are pictures of people who don't wear sunscreen and who wear, and you can see a difference. The biggest difference, I mean, for all the ladies out there, it's really great anti-aging.
Amazing.
You know, so
Amazing.
it's like a big factor. So I have patients coming, I want to do fillers, I want to do Botox, but they don't apply sunblock.
Yeah.
So I'm like,
Just like the
okay,
basic
the
step.
very basic step. And there are a few other steps which go wrong in like the retinol.
Okay.
All right. So people who wear retinol, but they don't wear sunblock. People who do vitamin C and they think that the vitamin C is going to give them the glow, but they don't wear the sunblock.
And how do you layer that? So do you put the vitamin C first and then the sunblock, or the other way around?
So I have like a morning and an evening routine. It's very simple. I don't like to give so many products. And especially for the men patients of mine, they're like, we can just do one thing, you know, just don't give us so many things. So I have simplified it for both females and male to be very simple. So in the morning, cleanse your face, very important. But before cleansing your face in the morning, please have your night routine fixed.
Okay.
You can't be sleeping with makeup on in the nighttime and waking up and then do your skincare routine. No. So in the morning, cleanse your face, a little bit of vitamin C and sunblock, basic. And this is personally what I follow. Evening, cleanse your face. You can now, it depends on like what type of age you are and what type of your skin type is very important to know. But if you start with retinol, so like let's say 30 and above, you're starting retinol. I have patients applying retinol as much as your palm, the size, and that is not the way to do it. So you first put the moisturizer, then you put the retinol, a very tiny amount, all right? And then you apply the moisturizer again, and then you go to sleep.
That's the night routine.
That's a night routine. But make sure you wait till the moisturizer like soaked up in your skin. Don't go directly in the bed, you understand? Because that your pillow is going to have that moisturizer.
Oh, of course.
We don't
It's going
want
to
that.
absorb everything.
Yes, and obviously the under eye cream, very important. And in the morning, I would really suggest you wear the sunblock on your lips also. So there are brands which actually now have SPF 15 for your
Correct.
lips.
Yeah.
I mean, before I didn't have, I would actually put the sunblock on my lips also to prevent, you know, further damaging. And it's really big because it's really basic, but long term, it has a lot of effect.
Right. So, you know, talking about SPF, because like I think this is something that has confused people years and years on end. So a lot of people have said anything above 50 is not I mean, there isn't such a big difference in terms of protection. Is that true or is that a myth?
FDA, it's like definitely saying the same thing.
Okay.
So 50 SPF, like 30 to 50 is like crucial. You have to. I personally like the 50 because it's a 1% chance. Like it's like
Okay.
97 to 98%. You understand? But I like the more protection. 50 SPF is the one. More than 50 SPF, I feel like it's more like commercial.
Right.
It's not really going to do much for you. And I mean, even for your kids, you understand? Like there's like 100% SPF, your kids to be all, safe and everything. No, 50 is basic or even 30. It depends on like, obviously we live in UAE. 50 is ideal.
Of course. And is there a difference between adult, sunscreen and like sun protection and children's sunscreen?
I mean, there is a bit of difference. You understand? I mean, there are sunblock which are like, specifically designed for the kids. So, for example, like kids have a very soft skin. You understand? Like while adults, we've already been through that soft era. Now it's a bit harsh.
Right. They're
Not
more
that
fragile.
harsh.
They're more
Yeah,
fragile.
they're more
Yeah,
fragile.
of course.
So we need to take care of that, and we need to apply on her. Like for example, my daughter, who's 3. Like I have made sure, like whenever she steps, like the first thing in the morning, she's gonna apply sunblock.
Okay.
No matter what, and then she reapplies it at midnight. Like not midnight, sorry, afternoon.
Midday. Yeah.
Midday.
Nice.
It's very crucial. So when she comes back from nursery, I'm like, sunblock. I'm like this crazy mother, but at the same time, it's very important. It can really affect her. And she does have eczema also, so I have to lotion her up. I mean, it depends on your kid. Every kid is different. So you need to know and understand what skin type they have, what kind of issues they have. And obviously the expert, the doctor, will tell you exactly what to do.
No, I applaud that because you're instilling in your daughter such positive behavior and good habits
Yeah.
for her to keep, for the rest of her life. I mean, if she's not used to it as a child, it's more difficult to get into that habit as you get older.
I was really like affected by my mom because of the pigmentation she had. So when I was like 13 or 14, she's like, did you put the sunblock on? I'm like, why, Mom? She's like, because you see my pigmentation? And she would scare us. But then it's actually right.
Yeah.
Pigmentations happen due to not doing protection.
Of course.
On your face.
Of course.
So it's very crucial.
Okay, so you mentioned skin types, and that was my next question. How do you know your skin type?
So there's skin type, and then skin type can be a combination dry and oily.
Okay.
All right. Then there's skin type. So there's 1, 2, 3, 4, 5, 6. Now, if you're confused what type of skin you are, obviously you have to go to the expert, because skin type, and it's very crucial when it comes to skincare, because we don't have the same skincare at all. So the oily skincare would be a bit different, a dry would be a little bit different, and combination would be much more different. And once you know what you have, what skin type you have, it's actually better for you to choose your products. You understand? Because I have a lot of patients, they're like, I don't know what products do I use, but my skin type, I'm not really sure. So when you come to the clinic, obviously where I work, or any expert, matter of fact, they'll actually tell you what type of skin type you have and what type of skin you actually have, oilies, combination, or dry.
So it's good to see an expert or a specialist to actually tell you what kind of skin type you have, because it'd be difficult for us to determine it on our own.
Yes.
Okay, perfect. So I want to get into a bit of a more serious note. We want to talk about skin cancers, and we want to talk about the different types of cancers. There are 3 types, and you mentioned them earlier, and I want you to mention them again and to explain to our listeners what they are and the difference between them, and what are some of the indicators of these different types of skin cancers.
So skin cancer and me, we actually have a history. So my grandmother had a skin cancer, and you really need to be aware, and you need to be smart enough to diagnose it earlier. The earlier you know, the better the outcome. So we have the 3 known skin cancers. So there's basal, squamous, and melanoma. So now the difference between all 3, I'm going to keep it simple. So the basal one is the most common one. It's basically like, let's say, pearly, or it's like a dome shape, and it blends in with your skin. All right. Squamous, I'll go with an SS. It's a bit scaly, all right? And you can feel it's a bit rough, all right? The melanoma, so birthmarks, all right? So I'll give you a little bit of trick when I tell all of my patients. So from A to F, all right? So the asymmetric, all right? The borders. And then we have the C, it's for the color. D for the diameter. E for the elevation, all right? And then F, funny looking.
Okay. So these are like the indicators.
The indicators.
What you look for.
So what you look for. So I kept it very simple. Now, I don't want people to go out there and start looking at their moles. Not really.
Yeah.
So you need to understand, like, if you have a family history, like such as I need to be aware. All right. Now, you need to understand your body. You need to, once in a while, just examine to see. Because sometimes you never know, God forbid, anyone can have it. And the climate is changing. All right, so the weather is unpredictable, as we know. I mean, recently the event, but the weather, you can see it's getting really hot. Sun, if you're not doing protection for your skin, obviously there are higher chances of you having skin cancer.
Right. I want to ask you, the next question I want to ask, I honestly have heard it from several specialists. I don't know if there's any truth to it, but are certain skin pigments more prone to skin cancers than others?
Definitely, yeah. So obviously the skin type 1 to 3, definitely. But regardless, you never know. Like me, my grandmother, she's skin type 4.
Which is, like, what are the numbers? What do they...
So it's 1 to 6. So 1, it's like, the red hair or extremely fair. So the second is, a little bit, it depends on, like, to explain to you, there's a scale. But, like, for example, you're a skin type, let's say, 4. All right? I'm a skin type 4. So is it uncommon for us? No, it's not. But 1, 2, 3, like, the more fair you are, the more high risk.
Of course.
But it does not write that skin type 5 or 6, they're not going to have it.
Right.
You never know. If there's a family history, and now we live in a very stressful environment. Stress is a huge impact in skin cancer also. Everything is like let's say, it goes together. So you need to understand everything. Combination can cause. You understand? So it's not only one factor. There are multiple factors.
Okay. So just to recap, because there's so much that was said, there are 6 or 7 skin types.
There's
six
yes.
skin types, and it just means that some might be more prone, but everyone is at risk.
Everyone is at a risk. You have to understand, for example, like my grandmother, like she's not skin type 1 or 2 or 3, she's skin type 4. And she just called me one time and she was like, listen, I feel like my mole is changing. And I'm like, what do you mean your mole is changing? She's like, it's not the same like it used to be. My grandma, she's quite smart actually. She had breast cancer, so, she had a bit of everything. Cancer in my family, it's...
Okay.
Everybody has something or the other. So she was like, no, I feel like it's different. So I was quite small back then. So I was like, Grandma, you're just, you're overthinking.
Yeah.
There's nothing to worry about. She's like, no, it was smaller, now it's bigger. And it's a bit irregular. And then I'm like, okay, she's quite, she's noticed quite a lot. So we took her to the dermatologist, and the dermatologist was like, we're glad that you got her quite early, and she does have melanoma. And we're like, oh, but we thought it was only in the white, in the white community. They're like, no.
Wow.
It can be with anyone.
Wow. Okay. That must have been an eye-opener for you as well as a
child. It was
child.
Definitely.
Yeah.
So now I have to take care of myself, my daughter. As I mentioned, my grandmother had breast cancer. She had skin. She had, thyroid also. My aunts also. So I really need to be updated.
Yeah, as you mentioned, there's so many factors as well, like stress. Environment, climate change, the food we consume. There's so many factors that affect, those diagnoses. Okay, so, it's May. June is around the corner, which means summer is here. I'm not going to say it's approaching. It's already here.
It's already here.
So what are some of the tips you have for people to protect themselves throughout the summer season? Like top 3 tips. I know we mentioned sunscreen and sunblock, but what are other practices that people should keep in mind, especially with children?
So with children, like for me personally, it's a big no. Like especially those harsh hours, like from 10 a.m. to like even like 3 p.m. I feel like it's too hot.
Okay.
So I wouldn't want my child to be in that outside in this hot, because obviously you have chances of, stroke. You have chances of like heat stroke. You have chances of dehydration, and I would completely avoid for children to be out there in this heat unless there's a shade. You understand?
Okay.
People going for tanning, I do not recommend that at all.
Okay.
All right, because it's really hot. Like, early in the morning around 8, you want to go out, have a little bit of sun, it's quite normal. But like after 10, I feel like it's better to stay maybe indoors or to be under a bit shade, you understand? Not directly under the sun. You're asking for trouble, I feel.
Okay. Okay. And hydration, I'm assuming.
Hydration is very important. Like I carry water with me, for myself, for my daughter, for like anybody who's like with me, like I have carry separate with me in the car.
Yeah.
I don't recommend to put the water in the car at the moment.
Of
It's
course.
really
Yeah.
hot.
I mean, keep it with you at all times.
Yeah,
but
all
yeah,
time,
if
yeah.
you're in the car with the water, keep it there.
Yes.
I feel like hydration it does wonders for the skin. I mean, skin, hair, nails, we always hear about that, but I've experienced it myself. Like water is also another underrated and neglected practice that
I'm personally bad at it.
Yeah.
But I'm trying.
I mean, we try. We buy
Yeah.
these fancy water bottles
Yes.
to drink more water, but yeah, I mean, we do our best at least. Okay, so we spoke about skin types and we spoke about, sunscreen and sunblock, but then, I feel like we're all bombarded with all these like TikTok videos and like Instagram reels about like all these skin routines. People spending a fortune, on products, on lotions, on serums.
I'm guilty.
Okay. So is there a use to that? Like, do you need to spend a fortune for your skin to be that healthy?
You don't really need to spend a fortune unless a procedure's gone wrong.
Okay.
So I do have a couple of patients from UAE, from outside, and they have a couple of problems, So, I mean, a recent patient of mine, I think she came from Italy or from Paris. I don't remember.
Okay.
But she had done a laser treatment there, and they ended up burning her.
Oof.
So she went there for this glamorous look and ending these patches on her face, pigmentation. So then you do spend a fortune. But if you just want to keep it simple and you've met an expert and you know that they know what your skin type is, you don't really need to. It's going to be it's not going to be in your budget, but you are going to be spending. But I tell all of my patients, when you're investing in your skin, it's really going to give it to you.
Okay.
Sooner or later, it's going to start showing.
Okay. There is that return on investment.
It definitely is.
Okay. Perfect. My next question has to do with that as well. Hyaluronic acid. Like I feel like everyone is talking about it. Everyone's putting hyaluronic acid on their face and like their skin. What's the big deal? Like I'm actually like interested to know.
Hyaluronic acid, now there are types.
Okay.
All right. So we have the skin boosters and we have for the volume lost.
Okay.
All
Can
right.
you explain that?
Yeah. So whenever you hear hyaluronic acid, automatically start thinking about fillers.
Yes.
All right. And living in UAE, the amount of lip fillers I've done, that's been a lot of lip fillers.
Okay.
All right. But no, hyaluronic acid, there's non-cross-linked and there's cross-linked. All right. The non-cross-linked, it's the one which is for the hydration. It's one for the youthfulness. The cross-linked one, it's the one which is for volumization. So, for example, you're very beautiful, all right? So when I see you, you just mentioned you drink water, but sometimes you don't really drink water, right?
Okay.
And you just want to hydrate yourself. I mean, you do drink a lot of water, but how do you give water directly to your skin?
Okay.
And that's when you add hyaluronic acid. The non-cross-linked. I'm not going to name the brands, but we do have amazing brands, fillers. Skin boosters, which has hyaluronic acid with peptides and amino acid, which is great. It hydrates your skin very beautifully, and you just feel so hydrated. But again, everybody asks me the same question: is it permanent? Nothing is permanent.
Right.
All right. Now coming back to fillers. I don't really like doing fillers unless it's absolutely important. I do have patients which completely come to me. They're like, no, I do want fillers. I'm like, okay, where do you want fillers? They're like, I want lips, you know.
Okay.
But for me, fillers is something I really love and have a huge passion about. So when I have patients coming up to me and telling me, doctor, what do you think? And I sit back and I'm like, all right, let's start.
Okay.
You know? So I look at you and I analyze you. And I tell them, I'm going to start pinpointing at things which you've probably never noticed, but don't start adding fillers there. But I'm just going to explain to you.
Okay.
So for example, chin filler. It's really like not like you don't hear about it so much in UA. You hear about lips, you know. But it's very important because chin can actually enhance your profile.
Oh,
You understand?
interesting.
So it can really make a huge difference, but obviously the right amount. We don't want like a huge amount or that Latin chin, you know, a little bit, which can hydrate you. At the same time, give you a little bit of volume, set your profile really right. Then you come back to lips. So as we get older, the lips tend to, you know, become really like small. And then you start like, okay, I feel like my volume has lost and I need to do something. That's when you add fillers.
Okay.
All right. And then when you talk about like chin fillers, cheek fillers, all right. So as we get older, or I say younger to my patients, there's subcutaneous fat, which kind of goes down due to gravity. So just to get that youthful look back, I like to add a little bit amount just so that it can give you that nice hydration, plumpy, youthful look.
Okay.
You understand? And we can never forget the temples.
Now that you mentioned that you can pinpoint stuff on a person's face, I'm actually interested to know, like when you look at my face, like for instance, do you see dehydration? Do you see like certain things? That's like for me.
All right. So
And
I
be
need
as
to first.
candid as possible. You.
Okay, I need to
Feel free.
first ask you your age.
Okay, 32. Not
32.
ashamed.
Not ashamed. Are you using any like? Do you do any skin boosters?
No. I mean, I use the usual stuff, which is sunscreen. I mean, a toner every once in a while just to like cleanse, skin cleansers.
All right. So let me just tell you. I mean, you've heard it probably so many times that I'm going to say it again. So when you turn 25, or actually earlier, your collagen drops.
Okay.
All right. Now, how do you stimulate your collagen? Is very important. I'm not a fan of like taking the collagen
Okay.
at all because it does not do much. So let's do the math together. You take it, it goes into your digestive tract, right? And then start distributing, all right? Now, skin is on top. So how much can collagen reach to you? Not that much, very minimum. So I rather inject.
Oh.
You understand? So now I'm not talking about you can inject every day. No, I'm talking about a monthly basis. You have a yearly plan.
Okay.
So whenever my patients come up to me, I tell them, let's have a yearly plan, like around 3 injectables in a year. You should be great to go, or 4, depending on each individual. For you personally, I would say minimum of 3.
Oh, wow.
You understand?
Oh, wow.
It will really hydrate you. At
Okay.
the same time, stimulate the fibroblast, which will give you the collagen. And this is something least spoken about in UAE, I believe, because it can really prevent you from aging.
Okay.
All right. So obviously, if you do like 3 injectables in a year, you can delay your aging.
Okay. Okay.
And I personally do it for myself. So I like to say I don't look like my age,
You
but
don't.
I mentally feel like I'm really old. But it really helps. It really helps. If you're really scared about like this hyaluronic acid, you can do your own product.
Okay.
In our clinic, we do something called plasma gel or biogel. It's your own plasma. Or you can do the PRF, which is, your own product again. But sometimes I tell my patients that age is a big factor also because your age gives out your plasma. You understand? So sometimes you need a little bit of boost, and that's when you use the hyaluronic acid.
Okay. Fantastic. Now we know what the hype is about.
Yes.
Okay. Exfoliation. My next question.
Exfoliation. It depends on your skin type.
Okay.
All right. Now, if you're oily, you can do thrice a week or twice a week.
Okay.
If you're dry, I would suggest once. All
Okay.
right. Or a combination. It really depends on how and what type of skin you have. But I do not recommend it on a daily basis. I had once a patient who had rosacea, and she was exfoliating her day on a daily basis. which was disaster.
Right.
All right. So rosacea is like this blushy red. It looks beautiful, but sometimes if you exfoliate like on a daily basis, it can get worse. So it was a completely disaster when she came to me, and she had also acne breakouts on top of that. It was just a mess.
It over exfoliating.
It
can
does. I
Actually
mean, your
affect
skin
you.
needs to keep that moisture in.
Yes.
You don't want to scrape your skin off.
Exactly.
You understand? You want to keep that hydration locked in. Yes, for an oily skin type, I would recommend a little bit more. But again, it depends. And if you are not sure of it, like this patient was, she's gone to someone and they recommended on a daily basis, and it made her skin worse.
Okay.
And obviously, she came back to me and she was like, "Nothing is working. I spent so much money, and I need a solution." And I just told her very simply, stop. And immediately, like, she came back to me after 2 weeks. She's like, "I feel already there's a changes." I'm like, "I told you so."
Yeah. Yeah. And sometimes your face, like the oils, your face oils, are actually good for you. Like to keep some of that.
Some of the moisture in.
Exactly.
But again, not that you go out in the outside and you keep that oily face on
no,
and go
of
back to
course.
sleep.
No,
You
of
need to
course.
like cleanse your face a
Cleanse,
little
but
bit.
not exfoliate.
Not
Like, I
exfoliate
feel
like
the
that.
exfoliation, as you said.
It's like once in a week I like it.
Yeah.
Not
It eats
not
away
more.
from your
Yeah.
skin. Like it scrapes, layers of that you.
And I wouldn't recommend in summer to do so much.
Oh, because your skin is more sensitive?
Yes, it is extremely sensitive. At the same time, like the crucial heat, we don't want pigmentation also.
Okay, interesting. Well, that's good to know. Okay. Dr. Asima, I can talk about this all day, honestly. And I told you this. I have so many questions, but your time is precious, and we're not going to take more of that. But my last question, just advice, general advice, top
General
3 tips.
advice, the top 3 tips I would give you is that if you are above 25, I highly recommend you start using an expert advice. But if you're younger, sunscreen is absolutely a must, all right? Make sure you don't forget your eyes, all right? Eye cream is absolutely very important because the skin around your eyes is quite thin compared to your face, and we tend to forget about your eyes, and you focus more on your lips or your, face more than you completely forget about your eyes. And then I have people for under eye fillers, completely different topic. We're not going to talk about it today, but just keep it simple, but make sure you're doing it on a regular basis. Don't skip a day because that can really do an impact. Like, for example, imagine today I don't put sunblock and I go outside, and let's just say I was on the bus stop for 20 minutes, 30 minutes, like around 1 p.m. I'm going to increase the chances of me having pigmentation. Maybe if it's on a regular basis, I keep on forgetting, I can have skin cancer. So like these small things can make a huge impact for you. And just keep yourself hydrated, very crucial. And just listen to your expert because they really have to say a lot to you.
Dr. Asima, thank you so much.
Thank
you for joining us, and thank you for your time. And we will talk about more with you, especially eye fillers, now that you mentioned it, because I have so many friends doing it right now. So we will have you back to talk about that.
A lot of stories I have to tell you. It was lovely to have you.
Thank you. Thank you so much.
Thank you.